Good evening. Winter pressure on the NHS begins to bite. A&E waiting times across the country have reached the worst level since January. As overstretched hospitals feel the pressure, health chiefs are urging people to avoid going to accident and emergency unless they're seriously ill. While NHS Greater Glasgow and Clyde reveals 2 in 3 people who turned up at its emergency departments did not need to be there. That's nearly 100 every day that medics believe could be treated elsewhere. Our chief reporter Sharon Frew has more.
Unless they are an emergency or an urgent case, before anyone is treated beyond these doors at Glasgow Royal Infirmary, they are seen by triage staff.
We're seeing people with upset tummies, sore throats, simple urine infections, injuries. You're getting things like ankle sprains, wrist injuries, simple wounds to hands.
Around the hospital, the public messaging is clear. This latest campaign is advising anyone with minor illnesses and injuries to call NHS 24 or consult their GP and other services first. In the emergency departments, winter pressures are building. The latest statistics for the last week of November show 48% of patients were seen within the 4-hour targets.
Sometimes we have a situation where all our cubicles are full. We've got very limited bed capacity within the hospital, so it's difficult to move the patients on from here. All our corridor spaces are full. We're having to keep people in ambulances before we can offload them. And that's not what anyone wants to have. It's certainly not what the staff want, but due to the overwhelming numbers, it sometimes does have to happen. There's a lot of elderly patients that we see, and frailty is a big issue for us, and we try and prioritise the frailer patients. This week certainly we've seen an increase in flu and COVID presentations to the department. Some of those have needed admission to the hospital.
Those in charge of winter planning stress patient safety is at the forefront, along with staff well-being.
I would say that this winter is already quite tough. I don't think any of our staff would say that they feel that there's been a respite. There's no doubt that there is a bit of nervousness about what winter is going to be like. We are asking the public to work with us. We're not asking people to stay away, but what we are saying is that 2 out of 3 people who are in our emergency departments perhaps could have their needs met better elsewhere.
Pharmacists and GPs are bracing themselves for the full impact of winter bugs known as the Big Four. Flu, RSV, COVID and norovirus can be far more serious than the common cold and can be potentially life-threatening to elderly and vulnerable patients.
Certainly got a bit to go before we reach the peak. As we head through December and into January, it will get busier with these conditions. Hopefully people will understand that there are other places they can go. They don't need to put all the pressure on the GP practices, and certainly we can offer good advice and treatment.
NHS boards go into the festive period with services already under strain. A plea today for patients to consider which is the right place for the right treatment to avoid hospitals facing their own emergency situations.